So let's start. My name is Docteur Lemaire. I come from France. I live on the French Riviera in Nice, exactly. And I'm a dental surgeon. I practice, I have a liberal practice since 1995. And I started practicing hypnosis at the beginning of the 2000s. So it's almost 25 years of experience in hypnosis. And I'm very glad and very honored to participate to this congress, World Congress, and to show you some interesting cases of hypno anesthesia. So I want to be the more practical, and I won't have a lot of theoretical aspects in this workshop. I will try to make a demo. We mustn't say try, but I like to say try because it's always experiment. And I work at the university also. I teach dental hypnosis at the postgraduate in Nice that we have created 10 years before. And I have also a private practice in hypnosis with an institute and a society of dental hypnosis in France. So let's start with our topic, hypno anesthesia. And it's a very fascinating subject on hypnosis because it's challenging and it shows at the same time the power of the mind and the body. So let's start immediately with the video. So this young lady, she must have a small periodontal surgery. Hello, Mike. And we make instant induction, only direct hypnosis. We deepen a little bit. I give suggestion. You will feel nothing. Go inside yourself. Everything's going to be fine. And you're going to make horses. I knew she was making horses. And imagine yourself, you're on your horse. And I want to create automatic movement to deepen the trance. I'm joking with her. And I give a lot of suggestions of comfort, well-being, go deeper, and at the same time, insensitivity. You'll feel nothing, everything's going to be fine. And you relax much more. And the more your hands are moving automatically, the more you go deeper in hypnosis, and everything is fine. Nothing is important. And I want to have this state of open mind, open reverie, because hypnosis is like a daydream, you know, to activate the somnambulic state of hypnosis. Now relaxation, your hands are very heavy. I test the relaxation and I transfer the relaxation on the part of the body that I will make the operation. So for the dentists who are in the assistants, and I knew some of them, I recognized them, it's just a small surgery, it's just a small periodontal surgery, it's a frenectomy for orthodontic reason. And while I make the surgery, I say, okay, now let's play a game. We make a game between your two hands. One is lighter than the others. And let's start. And when I touch it, one is going to be lighter and faster than the others. So I don't know which one is going to be the lighter. And if it's the left makes 1 point. And then we start again, and So it's just misdirection technique, levitation technique, and hypnotic phenomena in order to deepen the trance. And at the same time, I'm making surgery and I'm talking to her a little bit. I don't like to talk when I make surgery because I'm focused on my work as a dentist, as a surgeon. So I prefer to have a good state of hypnosis, a good level of hypnosis to create automatic conditional reflex. I would say automatic thinking, brain loop, you can call it as you want, in order not to have to talk during the trance. The revenge of the hand. Now levitation again, and which one is going to be the lighter? So it creates dissociation. It's important to focus the attention of the patient not on the mouth, which is the part that I operate, but in other parts of the body, because it deepens the trend and it's accentuating the dissociation between the... Okay, that was just a thought. So it's always interesting to make surgery like this, because as Spinoza said, no one knows what the body can do. It means that our experience came from our practice, our daily life practice at the office, and also the theory. And the theory, we must learn the theory from the great master of hypnosis like Milton Erickson, Dalai, and also the people who trained me, especially in the pain specificity of hypnosis, like John Butler was trained by Herman McGill, and Bruce Heimer, or people like this, Ron Etzlinger also. In modern hypnosis, I make three differences. So we had three generations of great practitioners, and it's very interesting to study their work because we must learn a lot from our predecessors. And we have operative hypnosis. It means I'm making the treatment, surgical treatment in hypnosis. Medical hypnosis, it will be more linked to the psychosomatic disorder of hypnosis. And therapeutic hypnosis, it's more psychological. So I will just talk about operative hypnosis today. Hypnosis is very strange because it's a specific discipline. It's between the science and art. I've made a lot of study about the history of hypnosis. I wrote a book, and what's important, according to me, is, as Bernard de Chartres said at the 12th century, we are just dwarfs on the shoulders of giants, and we must work and study the work of our predecessors in order to improve in hypnosis. And I see, when I practice hypnosis, always hypnosis as a art, because it means that you must develop freedom, creativity, intuition, and stuff like this, you know. It's not so scientific when you practice it. I have a few definitions. Definitions are important in science because it's a way to communicate, but it's also important because it defines what we are looking for. And if we have a good definition, we can understand each other, but we can also be more precise in what we are looking for. So, according to me, according to my experience with hypnosis, in operative hypnosis, we have hypnosedation, hypnoanalgesia, hypnoanesthesia. Hypnosedation, it means that you slow down the conscious of the mind and the body, like this, like it's a bubble, okay? It means slow down psychological and physiological. And then you can make the treatment with or without chemical anesthesia. But usually you have local chemical anesthesia when you make just hypnosedation. It's based on relaxation technique, and you want to bring the patient to what we call the coma state of hypnosis, or 𝒂𝒐 state. Then we have hypnoanalgesia and hypnoanesthesia. Hypnoanalgesia is a partial loss of sensitivity. Sensitivity, you have three components. You have the pain, you have the pressure, and temperature. When you make hypnoanalgesia, you just relieve the pain. Hypno anesthesia is a complete loss of sensitivity. So between hypnosedation and hypno analgesia and hypno anesthesia, the difference is qualitative. But between hypno analgesia and hypno anesthesia, the difference is only quantitative. So it means that, according to my experience, hypno anesthesia, when you have true hypno anesthesia, the patient doesn't know where is the operation, if it's there or there or there, if you have a complete anesthesia of the jaw. And also, it's like a kinesthetic negative hallucination. So it means that you must have a deep somnambulic trance to get it. And you can't get it. Sometimes, of course. I'm going to show you something interesting. This is a complex surgery with a 8-year-old kid. So if you're observative, you saw that she has surnumeral definitive teeth, the 1, 2, 12, and 22. There are 2 definitive teeth. And she's 8 years. So we have to make a surgery, a little bit, not complex, but long. I mean, for a kid, we have to remove the gun, to drill the bone, and to remove the definitive. And it was the only surgery that I made with a young girl like this. She was just 8. And I use a lot hypnosis with the patient, with the kids, because they have a good suggestibility. They are very good patient for hypnosis. And at the same time, it's important that their first experience at the dental office would be a good experience. So I usually say that the young patient are the patients of tomorrow, of the future. And we made it, and it was 45 minutes. So it was quite long, and I was really surprised how deep she was, and how, I would say, how she goes in a deep stuporous trance, because usually kids are very active. They open their eyes, they move, and she was very, very calm. I removed the gun. The more you feel the pressure, the more you go deeper in sleep. And I say the word sleep. I say in deep sleep, because it's interesting as a suggestion. We remove the teeth finally after drilling the bone. And at the end, she had difficulties. So she was moving, and she was coming back from the deep trance. And so I make a lot of hypnotic phenomena in order to deepen the trance and to create a misdirection for the mind. Then,
tu ramènes de l'énergie dans le corps, ça te fait bouger le pied, les bras, les mains, pour devenir normal. À 3, tu reviens sur ce fauteuil. À 4,
this is the emerge. Direct suggestion to come back.
Et là, c'est fini. Ça va? T'es contente? T'as été championne, hein? T'as été
And congratulations for the patient, of course. So I use what we call Hahnemannian hypnosis. It was designed in medical field during the 50s in the US. And it's more about direct suggestion and management of deep trance. In 2018, there was a very interesting project called Hypnoscience, which was in Zurich by Mike Brugger. And we had 50 subjects, and we evaluate the 2 kinds of trance. Deep stuporous trance and deep somnambulic trance for Ericksonian, and SDL state and somnambulic state for Hahnemannian. But it's just terminology. The semantic is different, but the state is the same. And the idea was to make the evaluation in quantitative and qualitative application. So it means brain imagery, but also neurochemistry and EEG. And you can see the difference between the 2 trends. So we have two kinds of trance, two kinds of deep trance, and that's the secret to get hypno anesthesia and to manage operative hypnosis. This is called the OXO, because it makes O, a X, and a O. I made this symbol for my students to train them in hypnosis and to explain them very simply how deep trance work. On the left part, you have in blue the conscious, and you see that you have the trance of relaxation. It means when you make a relaxation with your patient, you diminish the conscious. You diminish until being like a small peanut, I say. So there is a slowdown of physiological and psychological in the patient. And then on the right side, on green, it's the somnambulic trance. It's the activation of subconscious mind, or unconscious. It depends, your semantic, but for me the same. The difference is qualitative, but you can link these trends together, and sometimes you need to link them in order to get the aim that you want in surgery. Hypnotic phenomena are the tools that we are using to produce hypno anesthesia. We usually say that at the beginning we have physical hypnotic phenomena like levitation, catalepsia, things like this, automatic movement. Then we have more emotional hypnotic phenomena. Then we go to cognitive hypnotic phenomena like amnesia. And we usually validate a somnambulic trance with amnesia. Then you go to sensitive, and then you go to sensitive, it means hypno-anesthesia, and then you go to hallucination, positive and negative. So this is completely empirical. What I mean is that it depends on each patient. Some patients you can have the hypno-anesthesia without having the amnesia, but it's usually based on experience. It's, in fact, a scale of hypnosis. It's not the Stanford scale. It looks a little bit like the Harron scale, Harry-Harron scale, which is very simple. It's 6 items in hypnosis. And I like to keep it simple because I'm very practical. And I teach hypnosis to beginners, so they need things quite simple. And I usually say simple, but it's not easy. It means that you have to work on it to make it work. The difficulty is that I am at the same time the operator of hypnosis and the dental surgeon. So it means that I must deal my operation, but I must, at the same time, I must deal the trance. So usually, as I said, I don't like to talk during surgery. So what I do is that I make instant induction or fast induction. I deepen the trance until to go to somnambulic state, and then I install conditional reflex or brain loop or compounding technique, many things like this. It's just that I want the brain, each time that I do something, it deepens the patient automatically. Usually it's very simple. I say the more you feel sensation in your mouth, the more you go deeper. That's it. I don't be precise, it's unspecific. What I mean is that I don't want to bring back consciousness in a part of the body. It must be unspecific. But before getting that state, I must have the anesthesia. Okay? If you just go on the right part of this trance in relaxation, you can go to hypno anesthesia, but it will take a long time. That's what 𝒂𝒏𝒆 did, you know. He made hypno anesthesia with deep trance, mesmeric trance. There was no direct suggestion, no language. It was just mesmerism. It was magnetism passes. And so he made it during many hours, sometimes many days, and sometimes many weeks. So it's impossible to make it at the office because sometimes we have to make a surgery, we just have 30 minutes or 20 minutes or 1 hour or sometimes 2 hours, but usually we have very short time to make. So I prefer to create hypno anesthesia as a hypnotic phenomena, And then I use the relaxation trance because I will work on the body. This is implant surgery, and you see how it works to produce the hypno anesthesia. It's very simple technique. I just use hand glove, classical hand glove. So it's subtitled. So we use always what we call distraction filter. We say to the patient, all the noises of the office outside will bring you in a deeper state of relaxation. And then we say, all the sound that will have in your mouth, the water, vibration, and all the things that, because mouth is very noisy when you're working, is also a technique of deepening. I make levitation, reverse levitation. You can see the breathing of the patient, which goes in trance. If you observe the tip, you can see the REM. And then I develop the numbness just on the hand, like this, on the fingers. And ideomotor technique, just the patient tell me when he feels the numbness in the hand. Deepening technique also. And transfer of the numbness in the jaw. A lot of technique can be done. The patient can make it with levitation. You can transfer it like this. You say, okay, transfer it directly, and you tell me when you feel it, that it's getting numb. Or you can use also pressure. You press with the fingers inside the mouth. It was used a long time ago by Aaron Moss. Good technique of anesthesia. You press the vestibular and lingual part of the gum around the teeth. But the more simple, the best it is, because when the patient is convinced that he has insensitivity, just have to deepen the trance. And I use a lot of repetition. That's the key secret. That's boring, but that's very effective. I don't repeat exactly the same suggestion, but the meaning of the semantic is always the same, you know. You feel nothing, you feel comfortable, you feel well-being and full of confidence and security to start the treatment. Things like this, you know, quite logical. And each time I make direct suggestion, but the method is indirect. I just wait the patient to tell me when he's ready, and when he gets the numbness, when he feels the numbness, and then when he wants to go, when he wants to start, I don't say, okay, it's numb, and go. No. So we give operative suggestion. And then I don't talk, because I give a lot of suggestion, and so it's for implant therapy, it's flapless technique for dentists. In fact, implant therapy is not the most painful. It's impressive, but wisdom teeth are really a challenge in hypno anesthesia, you know? Because as soon as you get in the bone, the sensitivity is not very intense, you know. So the more difficult is extraction. and sometimes biopulpectomy. It can be very painful if you don't get the real hypno anesthesia. And if you just get hypno analgesia, sometimes it's not enough. For technical dentists, I just use hypno anesthesia for tooth preparation on vital teeth, for cavity preparation, for scaling and periodontal treatment, for gum surgery. But when I go to a deeper surgery like implant, like wisdom teeth, like extraction, I must have hypno anesthesia, which means that I must have the negative kinesthetic hallucination. So I must have a deeper level of trance. And we'll discuss about this because it's not possible for every patient to get it. So I won't talk a lot about pain because it will need a complete conference. But just remember that pain is a signal. And we usually say that there's no pain until it reaches the brain. It means that a lot of structure in the brain are involved in the pain management. And the hypnosis has the ability to modify the signal and the perception of the signal in the brain. We have in the pain-free component the sensation, the cognition, and the emotion. And we play on the free, of course, and different zone. It was the work of Pierre Ranville, who showed the difference between the sensation and the emotion. And it's not the same part of the brain that you activate. So that's why I usually use sensation to diminish and to annihilate the pain, but also the emotion, confidence, well-being, relaxation, and that's why the management of the two deep trance, relaxation trance and activation, stuporous trance and somnambulic trance are very important in operative hypnosis. I will talk about pain, acute pain and chronic pain, because it's a different universe, you know. We are not in the same field. In the chronic pain, you have, of course, sensation, emotion, stress involved, but also belief, knowledge, psychosocial status, secondary gain. So it's more linked to the hypnotherapy. But when I have some patients, I'm specialized in occlusodontology, and I have some patients for neuralgia and also vascular algae. And I start making treatment with hypno anesthesia, and if direct suggestion works, it's not so bad. But usually when it doesn't work, we have to go to a more hypnotherapeutic session, I mean a regression to the cause, parts therapy, or it's more hypnotherapy work. So it takes time. Are we okay? Yes, we are okay in the time. I show you, I have a patient for historical hypnosis. I wrote a book about this. And I show you a quick video to understand how hypno anesthesia has started. Hypnosis doesn't start with Mesmer in the 18th century, but since the beginning of man. And especially with primitive social organization, with the emergence of prehistoric shamanism. It was the first primitive medicine, and the trance was a way to heal subjects, to heal the body and the mind. A lot of descriptions of the trance state are done by paintings in caves, where you can see shamanic ritual in action, where surgical procedures like skull trepanation and broken bone healing were performed. Then, in ancient Egypt, medical procedures using hypnosis against pain are described in papyrus like Aiden papyrus. It's written, "Put your voice on the pain and the pain will be gone." Then the Greeks and the Romans developed a remarkably interesting technique using sleep temples. Presently, medical neuroscience is studying the impact of extended deep trance in the case of physical, like pain or cancer, or psychological trauma, like depression. Antique civilization invented the sleep temples for these extended deep trance, maintaining subjects in trance during many days, sometimes weeks. Remember that until the 17th century, healing is always linked to a spiritual part. We'll discuss later about all the ingredients of hypnosis, connected to anesthesia and healing expectation, belief, trance, and so on. At the same time, in India, the fakirs developed many techniques to control their body, and especially the arena of pain control, in order to prove their faith. So it was a French guy during the 60s. He was a fakir, and he could perform it. So that's crazy. Especially during wars, a lot of doctors like Henri Corneille-Agrippa or Paracelsus use primitive magnetism to manage pain. Paracelsus, for example, described hypno anesthesia on skin after burn or after a sword strike to suture a wound. In the 17th century, one of the most astonishing stories of collective trance occurred in Paris, the convulsionary of Saint-Médard. A Jansenist sect experimented very severe injuries to prove their faith in God, hitting themselves with hammer, making cuts with sword until live crucifixion. And they said they feel absolutely no pain. Then, in the 18th century, with Mesmer and Puységur, we also have description of minor surgical procedures without anesthesia, just magnetism. But the big jump is done in the 19th century by the Britannic trio, Elliotson, Esdale, and Bray, the pioneers of medical hypnosis. And we have also precise description of major surgery with the use of hypno anesthesia. Extensive experimentation were done also by the Russian hypnosis with Pavlov at the end of the 19th century. We always keep in mind that Pavlov is a story of a dog who salivates with the ring of a bell. But it was just a prelude to his intensive experimentation in hypnosis on humans. Incredible and wonderful experimentations. At the same time, the Paris School and the Nancy School of Hypnosis describe the use of hypnosis in medical field, and especially in pain management. During the 20th century, all around the world, hypnosis expanded. In the US, Lemaire, of course, taught hypno anesthesia for practitioners with the Esdale study. But also William Kruger in the specific field of hypnosis for birthing.
Straighten out. Spread your fingers apart. Your right arm is anesthetic from your fingertips down to your shoulder. Your right arm is getting completely anesthetic and relaxed from your fingertips down to your shoulder.
So, hypnotic phenomena and direct suggestion are always
numb and anesthetic. Completely numb and anesthetic. I'm going to place the needle right through your arm and you won't feel a thing. You were completely relaxed. Your arm was completely numb and anesthetic. You didn't feel a thing, did you, Betty? Now I'm going to remove the needle and you still won't feel a thing. There was no bleeding. Now that
he was training this patient for childbirth, and then he made a lot of maybe there's a video of childbirth without anesthesia, with just hypnosis. This is a Cæsarian made in hypnosis. And as the patient is a singer, the deepening technique is the more you sing, the deeper you go in hypnosis. Daphne Ewing, who worked on pain, especially with victims of burns. After the Second War, many doctors and hypnotists used to be trained properly for pain management and hypno anesthesia. Actually, in the US, Bruce Eimer and also Ron Slinger are making beautiful work in pain management. In the UK, Dr. Jack Gibson made also thousands of surgeries with hypno anesthesia. And one of our contemporary, Dr. John Butler, worked on medical hypnosis, pain management, and hypno anesthesia for various surgical procedures, many of which were filmed for television. John used also self-hypnosis for himself, and he had abdominal surgery, hernia removed, and he put himself in self-hypnosis for pain management. A variety of surgical procedures, including orthopedic, abdominal, hypnosis for childbirth, all with hypno anesthesia. You can see the trance of the patient with the eyes.
Moving the weight of bone. The first one involves a small blade vibrated by a drill. Quite apart from the pain centers in the skin that are still being stimulated by the holding instrument, the thawing is not a thought.
In France, Léon Chertok, a French psychiatrist during the 60s, was almost the only practitioner in France to use hypnosis in his medical practice and to develop hypno anesthesia for surgical procedures.
Laissez pas de mouvement, c'est un moment. Voilà, ne saignez pas. Voilà, voilà, c'est fait.
Ça ne saigne absolument pas. Vous avez fait 5 extractions. Nous avons extrait 4
So, if you have historical videos, just call me. I'm a big fan of historical videos and have a collection. So, I make a demonstration. We have time? Yes, we have time. Who wants to be a volunteer? Not to have a damn teeth extracted, just a demo. You come? Great. So, we'll make it in English, okay?
Yes.
It's very, very simple English. So, you like to go in trance?
Yes.
Yes, good. Are you ready to go in trance? Perfect. So, take nice deep breath and sleep. Go deeper, deeper. Relax, deeper. Okay, that's fine. Perfect. Take your hand and I lock the wrist, the elbow and the shoulder. It's floating in the air. As your hand is floating in the air, you will notice that you will go deeper in trance. Everything's going to be fine, quiet and easy. Okay, on each breathing you can go deeper. Perfect. If we want to go to deepen the trance, we can make, for example, a lot of technique of deep technique. I can make, for example, fractionation. I say, in a moment, I'm going to lift your hand. When the hand goes down, just open your eyes and think deep sleep and close them. Deep sleep, and you close, and you go deeper. You feel it? Deep sleep. Perfect. Wonderful. Now, I want you to focus your attention on the back of your hand, on this part that I'm touching. And I'll count from 1 to 3, and at the count of 3, you will feel that the back of your hand will be completely numb, completely anesthetized. 1, 2, and 3. And just let it come, let it go. Don't have to think about it, it will come. What is important when you want to get to hypno anesthesia or insensitivity, the patient must not bring back conscious. So if he tries to make it happen, it doesn't work because he brings back conscious. You just have to let come the sensation. You get it? Does it start? You can speak in hypnosis. Okay, wonderful. You're going to say, we install a signal, it's going to be easy. With any part of your body, will move automatically to mean yes to me. So I touch, it's getting numb and sensitive. Perfect. When it's completely numb and insensitive, any part of the body will move. Great, thank you. In a moment, I'm going to count from 1 to 3, and you will feel it twice more, and it spread into your fingers, all around your fingers until the pulp of your fingers. 1, 2, 3. And just let it come, completely insensitive. You double the insensitivity, and it spread into your fingers until the pulp of your fingers. I'm very specific and very detailed because it accentuates the dissociation and it brings back more sensitivity. And the idea is I use what we call a compounding technique. It means a repetition, but it amplifies. It's like a brain loop. Each time that I say this, you go deeper, or each time that I do this, you feel less. Something like this. And the brain loop, which is the aim of the subconscious mind, can go faster and deeper, and the answer is stronger each time that it circulates. When you feel the back of your hand and your finger completely insensitive, you just mean it automatically by moving any part of your body. Thank you. Great. In a moment, I'm going to count from 1 to 3 last time, and you will feel it completely numb, completely insensitive on the back of your hand, on your fingers, and on your palm. Your hand will be completely insensitive, completely numb. 1, 2, 3. Each time that I give a suggestion, numb, insensitive, numb, insensitive. I repeat, because I want to activate the word as a suggestion. Language in hypnosis has a creative power. It means that each word that we are saying in trance, but in conscious state also, has a physiological and psychological answer. And the idea is to amplify and to focus the mind. That's the key in hypnosis. It's just a way to amplify the subconscious, to have a different way of thinking. And when you're sure that your hand is completely numb and insensitive, completely anesthetized, you just tell me by moving any fingers automatically. Great. Each time I say to the patient to put him into a good mindset, be a spectator of what happens, experience, just be curious. Don't try to force or to resist. It's just to put him in a position, or we diminish the critical faculty of the conscious mind. Critical factor is when you say yes, but So each time I give a suggestion, I try to diminish the critical faculty in order to have a direct, automatic, and effortless answer. That's why I use direct suggestion, because I want this automatic. It comes directly from Pierre Janet at the beginning of the 20th century in France, this idea of automatism of the subconscious activity. Okay. Okay, so this is just a start, it's just hypno analgesia. But when we get hypno analgesia, it's quantitative. And then we go to hypno anesthesia by deepening the trance. That's it. So, for example, for a patient like this, if I have to go in surgery, I will train him first at the beginning to get this loss of sensitivity and then to transfer it. And then I will show you that it doesn't work like this. It's not magical. When I saw video, in fact, the patient have a training and there's a selection and a motivation of the patient. But sometimes the nature is well done and we can get it the first time the patient. My idea is that patients who are, like we say, 15 to 20% somnambulic patients are very good subjects because they can go in the somnambulic state and to have the ability to develop these deep trance. And hypnoanalgesia is just an hypnotic phenomena. That's it. Okay, in a moment, I'm going to count from 1, 2, 3, and your right arm goes down and your left arm will lift. 1, 2, 3. And as the arm goes down, it brings you deeper in trance. Stay focused on the sensation, the feeling of the heaviness of the right arm and the lightness of the left arm. Left arm is lighter, 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 and it brings you in a deeper state of relaxation. Everything slow down, the breathing, everything becomes quiet and easy, nice and easy. Wonderful. When we are making operative hypnosis, we must deal two factors. The first factor is pain, sensitivity, but the second factor is stress, anxiety. And each time that we have stress, anxiety, it's an inhibition to go in trance. And if the patient has fear, many fear of feeling something, fear of losing control, we must discuss with him because he will have resistance, he will have limits to go in trance. Okay, and now in a moment I'm going to count from 1 to 3 and your both arms will drop and you will go in deeper in trance. 1, 2, 3. Okay, just relax. Okay, wonderful. Then the patient is usually taught self-hypnosis technique to train because it's interesting if he has anxiety before surgery or if he can train at home. So usually we can give him audio, or if he understood the technique, we can make something interesting just very simply. Just before going to the emerge, just before the awakening, or depends how you call it, reassociation, I'm going to show a very hypnotic self-hypnosis technique, very simple. I say to the patient, each time that you will go to the office, you will go deeper and faster in trance. And now I'm going to show you something interesting for you when you're at home and when you want to practice self-hypnosis for yourself for a time of relaxation, or when you feel stress or when you have a lack of energy, you can use it. So I'm going to take your hand and you can, it's floating in the air, wonderful. And you can open your eyes. Okay, make like this, a sort of ring, okay? With your fingers and your thumb. And focus your attention on the distance. And you will see your fingers will move automatically until to go to your thumb. And when it touches, you close your eyes and you go deeper in trance. It will be your trigger to go in self-hypnosis for you. Take a nice deep breath, and when it touches, you go deeper, deeper, relax, deeper, relax. Wonderful. One more time, 1, 2, 3, open your eyes. Wonderful. And start again, just to practice. And when it touches, you go deeper in trance. Wonderful. You see the difference of the depth? Yeah. And last time, I make it 3 times. I don't know why 3, but 3 is good for me to train. And then you go deeper. Okay, good. And so the patient can go back home and he can practice. So it's just an anchor, it's just a conditioned reflex, but it's training. It's important for him to train himself to go in trance. In a moment, I'm going to count from 1 to 5, and you will come back. You will feel wonderful, full of great experience, completely refreshed, happy, and with good energy. At 1, you take a nice deep breath. At 2, you bring back energy in your body. You can move and everything becomes normal. That's a very important suggestion, post-hypnotic suggestion to give. I'll tell you why after. At 3, you can open your eyes and come back. You feel okay?
Good.
Thank you. Thank you for him. I say it's important to give post-hypnotic suggestion to remove all the suggestions that we gave, because sometimes I'm not careful, and sometimes the patient after the surgery, he wanted to write, and the hand was still numb, so he couldn't write. Or sometimes I make amnesia, and sometimes he couldn't write the numbers on the check. So that's funny. Yeah.
Did you cut his hand?
No, I use clamp.
A clamp?
Yes. No, I didn't cut because I didn't have. No, it's clamp.
But it's big pressure.
Yes, it's very big pressure because it's for surgery, and when you clamp completely, it's painful. Okay. You can test it if you want after. So let's back. I show you a wisdom teeth extraction, and that's interesting because I have the designer of this induction in the room today. So this is an homage for you, Ablashed. We are not a lot in the field of dental hypnosis, so we have to support and to work together. So I use a lamp like this. Very good subject, very suggestible. Sorry? Just watch the light, follow the light with the eyes, left, right, left, right, left, right. And then I say, as your eyelids are moving, close your eyes and go deeper in trance. Then I make a 𝒂𝒐𝒉𝒆, rigid 𝒂𝒐𝒉𝒆. I test it with the reverse suggestion. The more you try to bend it, the more it's rigid. And then completely numb, completely floppy. And it's not exactly precisely your induction, but the idea is to make hypnotic phenomena, you know. And then I give direct suggestion. You feel nothing. I give first always distraction filter. You hear all the noises in the office and all the noise brings you deeper in trance. And at the same time, in the mouth, all the sensation that you will have, water, noise, vibration, will bring you deeper in trance. And if something bothers you, just focus on the relaxation and like a wave from the top of your head to your feet, you give a big wave of relaxation to go deeper in trance. And I repeat it 3, 4 times, 5 times, I don't know how many times I repeat it, but I want to install this reflex, conditional reflex, Pavlovian reflex, in fact, very easy, to have this automatic answer to sensation. So you go down, you go deeper, you go further in hypnosis. And I ask the patient, when you feel that you feel nothing in the mouth, and when you have reached a level of trance enough for your security and your confidence to start, you will open your mouth. So always direct suggestion, but always indirect method. I wait for the patient to have his permission, and it's good because it's a good convincer, you know, for him. He's convinced that, okay, I'm ready, I don't feel anything. So I make pressure to test, and when we make hypno anesthesia, we see immediately when we start preaching if there's something, because we are very close to the patient. So we are very observative with the facial automatic movement, but also breathing. I used to use an oximeter to evaluate the pulse, but breathing is okay for me. Now I just see the pulse on the carotid to see if there's an acceleration and to see if it's breathing. And if everything is fine, we can go, and if there's anything, I said, patient, you can move, you can speak in hypnosis. If you say me, oh, I feel something, I can put local anesthesia. I'm not crazy about hypno anesthesia, you know. It's for the patient, so it's not a performance for me, but it's for the patient. And we'll discuss about this, because it's very important. The patient must have the good mindset. My dental assistant, she's trained also in hypnosis, so she makes the same job as I do, and usually I make hypnosis and I make the surgery by myself, but sometimes when I'm tired or when I'm lazy, I say, okay, deal the hypnosis and I just make the surgery. And so it's a good team to have a dental assistant trained in hypnosis at the chair, and also to have all the, I would say, conversational technique for the patient at the office. So we first remove a small root, and then was the wisdom teeth.
And you don't have to use this jaw separator?
No, never. I never use it in surgery, because I make 𝒂𝒏𝒆𝒔𝒕𝒉𝒆 of the jaw. So that's more interesting. I say, now feel your jaw is completely opening and relaxing.
It's wild all the time.
You can make it by suggestion, yes. And it's very more efficient than without hypnosis. That's the magic of hypnosis. And one day, it was 2 years before, I eat an olive, and olive is the worst enemy for the teeth. And I broke one teeth, the second molar. And so I had to, the teeth had to be extracted. And I say to a friend, he's a dentist, and also he made the postgraduate in dental hypnosis. So he knew what was hypnosis. And I say, okay, I can train myself with self-hypnosis, and we'll try to make it in self-hypnosis. And I used to break my feet on a motorbike accident, so I made a lot of self-hypnosis for pain management, but it was a time ago. And then I trained myself for this surgery. And I say, okay, let's see what happens. And that was interesting experience. And the most interesting is that I was very confident and secure, but the dentist was terrified. He was very stressed. Even if he had the knowledge and even if he had a training in hypnosis. But he said, oh my gosh, what happens?
Bonjour, Docteur Lemaire, au sein du domaine Hypnosis Institute France.
J'avance un peu. Okay. So, I put myself in self-hypnosis very easily. I put my hand like this, and I make the same exercise I did with you. I say, okay, I let come the sensitivity. And I call John Butler, who made this abdominal surgery, and say, okay, how did you train? And it say, it came one night when I was I had insomnia, and I was starting to develop loss of sensitivity. And the key secret is, if you want to get it, you will never get it. You must let it come. It's a reinterpretation of sensation. So you can use metaphor. You can say, I put it in an ice bucket, or I can put it, each one has the metaphor. But as I train myself, I can get it very fastly and transfer it in different parts of the body. For my student, I made some demonstration where I put needle in my cheek or in my arm like this. And what's funny is, as I get this training, when I make hypno anesthesia for the patient, I say, your hand is getting numb, and immediately I feel it in my hand. So that's just training. Self-hypnosis is only training. But it means that I train myself during 3 months, 3 times a week. So it's training, but it's good experience to understand how pain management works. So I go on because it's not fascinating. And he broke, for dentists, he broke the roots. So he had to drill. So that was not a good time for me. Accelerate. And what is funny is that at the end, and the idea that I had, it's something very classical. I'm very classical in hypnosis, and when we read James Braid, he had this idea, beautiful idea of monoideism. And it's something that we forget, but in trance we have the ability to focus the mind on just one spot. And my spot was, I feel nothing. I feel relaxation, and the more there's something in the mouth, the more I focus on relaxation.
How long?
20 minutes, 30 minutes. Basically, it's interesting, it's a good question, because when we make operative hypnosis, it can be 5 minutes, but sometimes we can have surgery, implant surgery with bone graft that lasts 2 hours, sometimes more. So it means that you have a good deep trance, because you know, after 30, 45, you can have very good level of trance. So that's interesting. So if you have questions, and then I will make a conclusion. Thank you.
Specific enough, really. Amazing.
Mike.
Excellent presentation,
thank you.
Really enjoyed it. The 3-time repetition, I think Michael Yapko talks about, but also it's 3 is easy because you don't have to count. It's
yes.
First, middle, last. So
yes.
Repetition is
yes. Anticipation for the patient. And we are, I usually use, of course, suggestion, but a lot of instruction, because instruction, it's quite easy for the patient, and he feels secure. He knows what will happen, and there is a subconscious anticipation. So that's very interesting when you want the more the suggestion to be accepted. That's just the aim of hypnosis. According to my experience, hypnosis is just a way to amplify the trance. Is just a way to amplify the subconscious. Subconscious is a different way of cerebral thinking. It's not a person, or it's just a metaphor, you know.
I was also going to say that sometimes when I speak to young dentists who have no knowledge of hypnosis, a common question when they see this is, Mike, what if the patient feels something?
Yeah.
And I say, wow, you're a dentist and this never enters your head. You know? We are dentists and the patients might feel something at any time. You know, so you alter your hypnosis, you give anesthetic, you manage the patient.
Of course, usually people say, okay, but what happens if they awake? Yeah. You know, I say they never sleep, you know, first, and then, as you said, you manage it classically. So, but sometimes, you know, I shouldn't say that if patient hears me, but sometimes I see the patient as the hypno anesthesia. He has the phenomena, okay? But he has fear and inhibition. He say, okay, I want to go in hypnosis, but give me a chemical anesthesia. I'm not sure that it's completely insensitive. And sometimes I make a placebo anesthesia. I just put the needle and I don't inject. And say, okay, now it's completely numb. So it means the power of belief and the imagination about the patient. It's not placebo because you have trance associated. In placebo, you don't have trance. But it shows that inhibition are the most important thing to deal with deep trance. If the patient has fear or inhibition, any kind of inhibition, I don't know what will happen, can you control me? So that's the importance of the pre-talk. And usually when I make surgery like this, they have ever experienced hypnosis 1 time, 2 times, 3 times, sometimes 10 times. So they have very great trance. So it's not a magical trick. It's just that people are motivated, trained, and selected because they need this.
I think we see this sometimes when we start work with a patient and say this is very simple, no anesthetic, no hypnosis. We start the procedure, it gets bigger, it's a deeper, and the patient is fine.
Yeah.
And you keep going, and they're fine because there's no expectation.
Of course, yes.
So they're okay.
Yeah.
What about these 8-year-old parents?
Yes.
They were aware of everything. How they cope with this?
Oh, that's very interesting. That's very interesting because, you know, basically I don't do this for patients when they are too young like this. But I used to have this patient several times because he has also orthodontic treatment. And one of the canine was included in the palatal verse. So I made a first surgery with classical hypnosis and with local anesthesia. Okay? And she was very, as all the kids, very somnambulic. So that's classical. But she was very in a deep trance of relaxation. And that's not classical for kids. Usually kids are very active in their trance. They move, they open their eyes, they move their body, so it's complicated. And I was very stunned to see how relaxed she was. And so I say to the patient, and I say of course to the parents, okay, we can make an experiment if you want. And the kid was okay, and the parents was okay. But the parents were more, I would say, ecological. Say, okay, no chemical is better. But according to my practice, you will see that it's not the majority of my surgery. What I mean is that it can't be applied to anyone. When I make dental hypnosis, everyone says to me, oh, that's good, you don't use anesthesia anymore. I say, no, it's not the case. I use local anesthesia when I need it, and sometimes I don't use it if the patient needs it, or ask for it, or if he is very talented to go in deep trance of hypnosis, and then I can propose an experimental thing. But it's really based on the patient, okay? So it's something, it can be impressive because say, okay, but That's a little bit hard for a patient, but I say if she had felt something, it wouldn't have been a big problem. I would have put local anesthesia and continue like this. But it's important for two reasons. I will discuss at the conclusion. That's the most, according to me, interesting thing in the hypno anesthesia. It's not a challenge for the operator. That's it. Yeah.
Congratulations. It was an excellent talk.
Thank you.
Question number one: how do you select patients?
Yeah.
Do you refuse patients sometimes?
So
if you refuse, say that I will not do the hypnosis for you.
Yeah.
And how you do the preparation? Do you suggest them to go to have several sessions before?
Oh.
Do you want to do a really deep
hypnosis,
or
so
you teach them how to do self?
I'm a man. My mind is very slow. So give me your first, and I answer little by little. I can't do twice at a time.
Selection. So
selection. Selection is very interesting. First, usually when I have patients at my office, they have, for example, a dental treatment. And when they come at the office, we give them a medical questionnaire. And we say, are you stressed to come at the office? We use hypnosis. Do you want to use? So it's just a proposition. I must have 10 patients a day, and I must use hypnosis on half of them. So I don't force anyone. I can make treatment without hypnosis. It's not a big deal. Okay? So then if the patient is okay to make hypnosis, I start making hypnosis in a very classical way. I make a pre-talk. I make some tests, like ideomotor tests, you know, things like this, like many very classical induction deepening technique, and I see what I get, and I test the level of trance. That's very important, because test is a confirmation for me to see the level of trance that the patient can get. It's also a good convincer for the patient, because the patient can realize that something happens, and it's also a good deepening technique. And how do I test? Very easily with this kind of pyramid of hypnotic phenomena. I make an amnesia, for example. I say, in a moment, I'm going to count from 10 to 1, and you will forget the number between 5 and 3. And the patient goes 10, twice deeper, relax, 9, twice deeper, 8, and I check that they get the amnesia. When I get the amnesia, usually I realize that they go easier in a somnambulic trance. Somnambulic trance is oniric trance. It's like a daydream, okay? It means that the brain, usually I say to the patient, to the student, hypnosis is very easy. During the day you're conscious, during night you're sleeping and you're dreaming. When we make hypnosis, we make a cerebral switch. We make you dream during the day. So it's a metaphor, but I don't care. It means that we activate the brain differently. And as it works differently, all the psychological and physiological answers are different. So, at the first session, I see, and I'm not better than others. What I mean is that usually I got 15 to 20% somnambulic subject, which is the average. I got 40% patient which goes in medium state of hypnosis, so it means physical and mental relaxation, but they don't have cognitive hypnotic phenomena, so I know that it would be difficult to bring them in hallucination and stuff like this. And I must have, I would say, 20 light state of hypnosis, like relaxation of the body, like training Schultz and Jacobson relaxation, you know, just relax, but and 10% I would call them resistant, or I don't know how to call them, but it doesn't work. So this is the first session, but the second session is completely different, and the third is completely different. So the idea is that if there's a surgery, for example, a wisdom teeth, I will make 3 appointments if necessary, and if the patient needed it. And then the first treatment, I make the questionnaire, I make scale, clean the teeth, something very easy just to evaluate the trends. Then second time, if there's a cavity to make, I make the cavity and I check the level of trance. And I give always post-hypnotic suggestion. Next time you will go deeper, you will go faster in trance. And if the patient, we didn't discuss about dental phobia, but it's different. But if it's just stress, anxiety, the patient see that each time that he goes on the chair, he can have the treatment. And my importance for me is the treatment in comfort and well-being. So it means dealing anxiety, stress, and pain. That's it. I can deal as I want, chemical, hypnotical, but the idea is that the patient has an experience of well-being and relaxation. Then usually, after the third time, so Mike say 3, and I agree totally, after 3 times, 3 sessions, usually the patient goes in somnambulic state. And it's based on the experience, but also historical research. Bernheim at the School of Nancy say, oh, I discovered something interesting. The first time the patient came to see me, I had this light state of hypnosis, and then the second time he come, I had this state, and that's it. And one day I had a patient and he was phobic, and phobic patients are the best patients for the hypnosis because they have such a negative hallucination that when you turn it into a positive hallucination, they get so much confidence in their self and in the treatment that they develop deep trance, you know. And we had to make implant, and I say, ooh. So first session, hypnotherapy. No dental chair. First session, hypnotherapy with regression to the cause, or, I don't know, parts therapy, any therapeutic technique to deal with the phobia. And then the other session, we use hypnosis just for the patient to develop and deepen the trance. In pain management, the secret is the level of trance, according to me. You know, you must go to a somnambulic state with hallucination, and with a lot of intensity if you want to have the results. And at the 5th or 6th session, I don't remember, we had to make implants, and the patient say, "Okay, I'm confident. I don't need hypnosis." I say, "Oh, wonderful!" And he put himself on the chair, and he fall himself because everything is a trigger, you know. And we usually, the main difference between operative hypnosis and therapeutic hypnosis is that I have always better trance when I make operative hypnosis, because no one wants to be on a dental chair first. So it's always an element of fear. And when you give a tool to say, okay, I have a tool to make your mind go far away and let your body relax, and to be well-being and comfort during the treatment, everyone wants to get it, especially when you're stressed, you know. So what I mean is that the posture is important in hypnosis, but according to me, the frame is the most important. And the frame for dental hypnosis is that no one wants to go to the dentist. So that the best frame to create trance. And usually I have more resistance when I make therapeutic hypnosis. That's normal, because the value is different, you know. Does it answer to your question? Yes, yeah. So it's very subjective. You can't say do this. It's very client-centered hypnosis. It depends on the patient, and I never force the patient to go in trance. You know, it's like a tango, where I make suggestion, I see how he reacts, and I see how far he can go. But, you know, we never know what happens. And usually with the experience, I say we must never project what will happen. In trance, you usually make this, you know that the patient relax. But trance is very individual. You can make different trance. I had a patient who made crazy trance, you know. They become completely, I don't know, floppy, or sometimes very active, quite hysteric movement. So that's very weird, you know. So I'm always curious to experiment and to see what will happen, because in fact I never know what will happen. And the experience is just that I know how to deal, and sometimes I don't know. So let's see. Yes.
Can you give us more examples how to manage with psychosomatic pain?
Yes.
I'm from Ukraine.
Yes.
And I control my body with the pain.
Yes.
We have alarm, war alarm,
yes.
measles, yes, in my phone, and I couldn't sleep. I had
yes.
insomnia because always
yeah.
alarm. Then I turned off the alarm
yeah.
on my phone, and my neck began to
oh.
only during the night.
Okay.
I'm okay during the day,
yeah.
but when I go back,
yeah.
my neck began to...
It's a tension of awareness. Of, yeah. We'll make it after, because chronic pain and psychosomatic pain is very different. Because the main difference is that when we start the procedure, there's no pain. And it's easier to start when there's no pain than when the patient comes with the neuralgia since, I don't know, 3 or 5 years, and he had made all the treatment, so there's a lot of emotional, cognitive components linked to the pain. But as you said, we saw together. Okay? Last question? Yes?
It's very impressive, your work, and I would like to learn this.
Yeah.
In my case, I'm a psychologist.
Yes.
I'm working with patients with pain.
Yes.
And it would be great to help them to lose their pain.
Of course.
And I'm aware of doing hypnosis, and I'm not too bad, but this is magic to me. And
yeah.
How can I learn this?
Do you speak French?
No.
No. You speak English? My training at the university is unfortunately only in French, but I can give you reference of great practitioner in pain management. You have Mark Johnson, for example, and you have a lot of very people dedicated to the specific field of hypnotic management of the pain. Especially in your office, you won't have to do this. You will have more chronic pain. You won't have acute pain. Acute pain is easier to deal. Chronic pain is complicated. Not complicated, but it's more. There's a lot of components that are involved. So there's a lot of training. You're from Germany?
Austria.
Austria. Yeah, I guess there's a lot. It's one of the topics that was the most studied in hypnosis. Pain management. You have, I don't know how many articles and brain imagery, because it's quite easy to evaluate, you know. Therapy is more, epidemiology in therapeutic hypnosis is more complicated because it's more subjective between the operator and the patient. So pain hypnosis is more evaluated. Last question? No? So I'm fine on the time? Wonderful. So I came to the conclusion. I film every session in hypnosis every day for my training in the university and for thesis for my student. In Nice, we have a laboratory of experimental hypnosis, and it's just a big name to say that we can bring database for the student to make their PhD with their thesis. So we must have, I think, maybe nowadays more than 15,000 videos, and 65% is hypnoanalgesia, okay? And only 15% is hypno anesthesia. And that's the end of my conclusion. What I mean is that if you want to get it on your patient, you can't get it on every patient. That's impossible. Otherwise, it will take you too many hours. If a patient, for example, if he comes to the office for the first time and is in light state, and I don't know how many hours it will take to train him, but I don't make it because I have my schedule, and all the dentists, we are timed all the day, and I must use direct and simple hypnosis to get the most deepest trance I can get, but I deal with what I get and what the patient gives me. So first, to get hypnoanesthesia, you must have a motivation of the patient. Not mind motivation, the motivation of the patient. It can be different kind of motivation. First motivation is, I don't want chemical anesthesia. Second motivation, I am allergic, but that's very rare, in fact. Third, I had one time someone with the autoimmune syndrome. I don't know which one. It's very rare. And he couldn't have any chemical anesthesia. But it's one patient over 10,000, I think. So the motivation comes from the patient. Then there is a selection. As we say, we must see how deep he goes in hypnosis. If he wants to have his wisdom teeth extracted with hypnosis, but if he's not a good suggestible subject, I won't spend, I don't know, 20 hours to increase the trance. Usually there's a training, but the training is included in the dental session. What I mean is that when there's something traumatic, I make it at the end of the treatment, of the dental treatment, because I have 5 sessions of dental classical treatment, and at the end we made the extraction, the implant, and the nasty things. And then the more important is the confidence of the patient, confidence in himself, confidence with the operator, and confidence with hypnosis. That's belief, convincer, all the things like this, you know, that are psychological are very important. And I would say that it's not a performance from the operator, but I make it for 2 reasons. First, it gives me a lot of good technique to manage pain, okay? And a lot of good technique to manage deep trance. And in operative hypnosis, usually I say the difference is that we must have a lot of hypnotic technique, but not a lot of psychological technique. And hypnotherapy is different. You don't need a lot of hypnotic skills, but you have a lot of psychological skills. So that's the main thing. And actually at my office, I used to make therapeutic hypnosis during many years. And I'm more involved since 5 years with operative hypnosis, because it's the kind of hypnosis that I like to practice. And my assistant, that's why I was talking about the collaboration with the assistant, is making the hypnotherapy part. So it means only the dental hypnotherapy, but it's bruxism, smoking cessation, weight control, many things that you can do with hypnosis, gagging, reflex, bruxism, things like this. So that's interesting to be a good team also at the office, because one can make the hypnotherapy, and hypnotherapy is a long session, it's usually 2 hours. So during my day, I used to put 2 hours twice a week just to make hypnotherapy. But now I'm more dedicated in operative hypnosis, because that's more what I like. And last time, be interested in, I used to make a lot of street hypnosis. And I know that in the medical field, people say, oh, no, stage hypnosis, oh, that's a shame, that's the devil. And I'm not convinced. I'm sure I have a lot of friends. I was trained by Hormone McGill, and he was the father, the dean of American hypnotists and dean of stage hypnotists. And I'm always looking for good technique coming from stage hypnosis, because it's the management of somnambulic state. And you learn a lot from direct suggestion, and you learn a lot from dealing with hallucination. And hallucination is oniric dream. So there's a lot of further research actually made in France in what we call oniric hypnotherapy. It means the development of a state of dream, and you activate different function of the dream in order to cure the patient. And I think it's a very interesting way to project ourselves in hypnotherapy. So that's it. I say thank you for your attention. If you have questions, thank you so much. You can contact me now. I can give you my mail or anything you want, and we can talk. Thank you again. Thank you.